Welcome to the EduCare course titled Coronavirus COVID-19. My name is Ethel McClinsky. I am a registered nurse and I will be your facilitator. A huge thank you to Kari Everson, the president of Uvoya, a senior care consulting firm, for her assistance in creating this course. COVID-19 is a respiratory disease caused by a new coronavirus that was first detected in China in 2019 and is now spread internationally, including the United States. Coronaviruses are a large family of viruses that are common in people and in many different species of animals. COVID-19 is a new disease, and the Centers for Disease and Control, or CDC, is learning more every day. We are learning how this virus spreads, its severity, and to what extent it may affect people in the United States. This course is intended to provide you the information currently available, including symptoms, infection control practices, and how to protect yourself and those in your care. The COVID-19 virus is linked to a live animal market in China and is now spreading from person to person. COVID-19 appears to spread easily and is more easily spread when people are living in a confined area, such as a cruise ship, dorm at school, skilled nursing facility, or assisted living facilities. This means that many of those in our care are at much higher risk of contracting and spreading the disease to others. In addition, the elderly, especially those over 80, are much more likely to die from the disease and have more severe symptoms. Coronavirus is thought to spread mainly from person to person. This happens when people are in close contact with one another, within about 6 feet, and through respiratory droplets that are produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. It can also spread from contact with contaminated surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or object that has a virus on it and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spreads. Symptoms can range from mild to severe, with even death. After an individual is exposed to the virus, symptoms can appear within 2 to 14 days. Yes, it can take as much as 2 weeks for symptoms to appear. It is unknown, but likely, that a person can transmit COVID-19 before they exhibit symptoms of the disease. Symptoms include fever, shortness of breath, and cough. Symptoms vary depending on the individual. As stated earlier, older adults, as well as people who have serious chronic medical conditions such as heart disease, diabetes, and lung disease, are at higher risk to become very ill with COVID-19. This is likely the population of people that you serve today. This is why we must be vigilant in how we respond to the threat of this illness. In the event there are confirmed COVID-19 in your area, for example in your county, and you're working in a facility setting, it is recommended you reschedule outings, limit or cancel large group activities, consider meal service delivery to private rooms, and restrict visitors, or at a minimum interview visitors prior to entrance, and supply personal protective equipment if a visit is necessary. The goal is to prevent and control the transmission. While we do not know the extent of COVID-19 reach, it is imperative to plan for an outbreak. It is better to be prepared and not need your preparation than to be left scrambling and unprepared when it happens. Now is the time to review your emergency policies and procedures, increase and monitor your supply of personal protective equipment and other emergency supplies. Ensure all emergency contact information and lists are current and up to date for clients and employees. Provide education and resources to employees, clients, and visitors, and provide additional oversight into infection prevention and control interventions. Additional planning and preparation interventions that you can take include posting signs for employees, clients, and visitors about preventive requirements. It is recommended by the Department of Health to designate a person on your team that will be the primary contact for any illness reports so that proper tracking and reporting can be followed. This person can also be responsible to monitor all new information daily from the Centers for Disease Control, or CDC, as well as the Health Department. This person will ensure that all employee sick policies are documented and clearly communicated to all team members. This includes actions that should be taken if an employee should become ill at work. And because new information is available ongoing, stay informed. Keep your employees, clients, and visitors informed. This communication will be continuous and ongoing and will assure you and your organization is prepared. During this time of controlling a possible outbreak of COVID-19, the best way is to limit or restrict people from coming in and out of a facility or home setting with our at-risk population. It is recommended to restrict visitors' access to only essential personnel, and those essential personnel would limit their access to only essential activities. We know that the disease spreads from person to person. For someone visiting, identify if the person has current signs and symptoms of respiratory illness, if they have had direct contact with someone with confirmed COVID-19 in the last 14 days, if they have traveled internationally within the last 14 days to an area with community spread, or reside in an area in the community that the virus has been discovered. What can we do collectively today and ongoing to prevent a widespread outbreak from occurring? First, make sure that proactive prevention is in place. And this starts with everything you know and apply in the area of infection prevention and control. We have organized this into 3 simple steps: wash, disinfect, and report. The first prevention step is to wash your hands. We know that you practice good hand hygiene every day in your work, so this is not new to you. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. In a moment, we will demonstrate hand washing as a reminder of the key components to hand washing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. The Center for Disease Control, or CDC, recommends the following steps for hand washing. First, move your sleeves up and wet your hands with clean running water. Apply soap. Lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Keep your hands lower than your wrists. 20 seconds is a long time. Some people remember by humming happy birthday from the beginning to end twice. Keeping hands clean through improved hand hygiene is one of the most important steps we can take to avoid getting sick and spreading germs to others, especially those in our care. Our goal is to protect the individuals in our care from being exposed to any disease or microbes, and to protect caregivers from your exposure to a dangerous disease. Now the hands have been washed for at least 20 seconds. Rinse thoroughly under water. Dry thoroughly with a clean paper towel. Turn off the faucet with the paper towel. Making sure all hands are clean, extend to those in your care. Assist your clients in washing their hands and using alcohol-based sanitizers after they use the restroom, after they cough or sneeze, after they blow their nose, and before and after eating a meal. Everyone needs to practice good hand hygiene to prevent transmission. And remember, If you have assisted someone in hand hygiene, you must wash your hands again after that assistance. The second prevention step is to disinfect by implementing environmental infection control. Clean and disinfect frequently using surfaces and equipment. Cleaning removes dirt from a surface, but it does not kill germs. However, by removing them, it lowers the risk of spreading the infection if the surface is contaminated. Disinfecting means using an EPA-registered disinfectant to kill the germs or a solution of diluted bleach. Refer to the manufacturer's instructions for cleaning and disinfection products that you will use to ensure proper utilization and maximum effect. Surfaces and equipment that should be cleaned and disinfected include tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, iPads, toilets, faucets, and sinks as a start. And for equipment that is used and shared by those in your care, such as a blood pressure cuff, pulse oximeters, community computers, or iPads, they must be cleaned and disinfected after each use. Limit as much as possible the sharing of equipment and never share equipment with someone who has a known case of COVID-19 or any infectious disease. When cleaning and disinfecting supplies and equipment, gloves should be worn and discarded after each use. Upon removing the gloves, wash your hands. The third prevention step is to report. Report symptoms of fever, cough, and shortness of breath immediately, whether they are your own or the person in your care. If you have these symptoms, stay home. Call your supervisor and report your symptoms and seek medical advice as needed. If you observe these symptoms in a client or resident, report it immediately. While the symptoms could be related to a common cold or flu, the immediacy of your report is critical to determine the cause of the symptoms. Protocols such as testing, the use of additional personal protective equipment, and isolation may follow, depending on the outcome of your report. Applying the planning and prevention strategies that we discussed is critical. But what if someone presents symptoms of COVID-19 or tests positive to the virus? Currently, there is no vaccine for COVID-19, and the care or treatment is supportive only by treating the symptoms. The goal is to care for the individual in your care or transfer to an acute care facility if the symptoms are severe. If you have 2 or more employees or clients who have respiratory illness symptoms that have not been diagnosed with a different respiratory illness, the Department of Health wants to be notified. The department will make recommendations for next steps. During the time in which respiratory illnesses have been reported and either suspected or confirmed COVID-19, there are steps that your organization will need to take immediately. The infected individual should be placed in a private location, and all people entering that area will need to use precautions, as we know that the virus can spread in the air or on surfaces. Precautions include wearing a gown, gloves, and a mask when in the person's room. If N95 respirators are available, they should be used. If not, regular masks can be used as long as aerosol generating procedures such as suctioning is not being performed. The person may need to be transported to a care facility or isolated at home, depending on your setting and the severity of the symptoms. As you just learned, you will be required to wear a gown, gloves, and a mask or personal protective equipment. All personal protective equipment or PPE must be kept outside of the room where the symptomatic person resides. It is imperative that when using PPE that you avoid contamination to yourself and others while applying it and removing it. When using a gown, mask, and gloves, you will apply them in that order. First gown, then mask, and finally gloves. The first step is to apply the gown. To apply the gown, pick it up and unfold it. Slide your arms through the armholes, keeping the opening of the gown in the back. fasten the ties at the neck opening, and then fasten the ties at your waist, making sure edges of the gown overlap to cover the back of the clothing. You must completely cover your arms and torso. The second step is to apply your mask. Secure the ties and make sure it is snug to your face. If you are using a respirator, fit check the respirator. If goggles or a face shield is required, you would apply it at this time. Finally, apply your gloves. Be sure to pull the gloves up over the gown cuffs and your wrists are totally covered. Now, you are prepared to enter the individual's room. Once you have completed cares, you will remove all of the personal protective equipment at the doorway, either before or immediately after leaving the room, depending on the setting. Please familiarize yourself with your organization's policy on this. You will start by removing your gloves. When removing the gloves, be especially careful not to touch the outside of your gown or glove. After you remove the gloves, dispose of the gloves into the designated container without contaminating yourself. Let's watch a short video on how to properly remove gloves. After care, assume your gloves are contaminated. You will want to remove them in a way to protect yourself. Remove left glove with right gloved hand. Scrunch the left glove in the right hand. Slip the left hand under the right glove. Remove and throw in the trash. Notice that she never touched the outside of the gloves. And then wash your hands. Now that your gloves are removed, you will remove your gown. Unfasten the gown at the neck and the waist. Remove the gown without touching the outside of the gown with bare hands. Do this by using your hand under the neck of the gown and pulling down. While removing the gown, hold the gown away from your body. Fold the outer surface, which is contaminated, inward and roll up the gown. Then dispose of the gown into an approved container. And the mask is the last thing to be removed. Be careful not to touch the outside of the mask, as the outside is considered contaminated. And finally, when all the personal protective equipment is removed and placed in the appropriate container, wash your hands again for at least 20 seconds. Just like any infectious disease, protecting yourself and those in your care is critical. Your preparation, planning, and preparedness is important to prevent and control the transmission of COVID-19. And the news and information about COVID-19 is fluid and rapidly changing. As a result, stay current with the latest information by logging into the CDC website, monitoring your State Department of Health for directives, and watching for guidance from other agencies such as the CMS, the Centers for Medicare and Medicaid Services, and your trade associations. Your continuous knowledge and preparation will assist in ensuring the safety and well-being of those around you. Be well. Thank you for your time and attention. Please take the knowledge assessment that follows this course. For questions or more information, we encourage you to speak to your supervisor.